Hey everybody, it's Holly with Kick-Ass Birth here with another quick tip following up on last week's when we talked about like how to cope during the epidural procedure. And last week I talked about what the partner can do if they ask the partner to leave during the procedure and how that partner can like maximize that time so that when they come back they're really refreshed and ready to go. So let's talk more about what the mother might experience and how she can cope with this. I know a lot of my clients who are hoping to avoid pain medication are nervous about the needle in the spine, the procedure itself. So let's just talk realistically about what it actually looks like and what kind of things she can do to get through it. First of all, if the partner's in the room, that would be the primary supporter, most likely. So some hospitals are cool with that. Otherwise, she would have a nurse be her helper through the procedure. So the way they get the mother in position, she sits on the side of the bed. They put something underneath her feet so she can feel stable. And then they'll put a little, bouffant, a little blue hat on her. She's got her gown on that opens in the back. And they'll have her get into an exaggerated C curve. So it's like this, like her whole back is curved so they can access the space between the vertebra. And she has to remain still through the procedure, which is tough if she's having contractions. So some tips for that would be when she breathes, to breathe long and slow. So that way her body's not jerking, she's not making sudden movements, but she's still able to cope. So doing, just and as much as possible keeping her body still while still breathing. She also will be probably holding on to her support person, whether it's her partner or nurse, and gripping that person's arms tightly, looking into their eyes, and this little mental trick of even sending all her energy and all of her pain into that person. Just really intent, holding on to that person for dear life, which is kind of a nice way to get through difficulty anyway. But in this case, that nurse would be like an angel who comes in